Welcome to Thursday's edition of COVID-19. For the second straight day, the daily tally stands at above 600 cases, and authorities are calling for a stronger sense of public responsibility to ensure a better containment of the situation here on the local front. I've Kwon-Soa standing by with the latest. Now, Soa, in a rather ominous sign, I understand our numbers for this Thursday are exactly the same as yesterday's.
You're right, Sunny. So let's just get straight into the figures. 621 infections were recorded as of 12 a.m. this Thursday. And even the number of domestic transmissions, thus also the number of imported cases, is exactly the same as Wednesday. So with that, cases are now in the 600s for the second straight day, adding to concerns that the third wave of the virus won't be over in the near future. And now Korea has surpassed 85,000 total cases of the coronavirus, with the death toll standing at 1,544. Now, this Thursday, the Metropolitan region accounts for 443 infections, which is a slight rise from Wednesday, while there are also double digits in the Chungcheongdo provinces, as well as in the southwest and the southeast of the country.
Right, so and many of these new cases today have been traced, that is, to large cluster infections.
That's correct, Sunny. Medical facilities such as 2 general hospitals in the capital, Seoul, have now a total of over 100 cases respectively. And also group infections linked to private gatherings and workplaces are increasing. And what's especially worrying right now are mass outbreaks at manufacturing plants. A plastic factory in Gyeonggi-do province's Namyangju reported a total of 120 infections as of this morning, and a boiler making factory in Chungcheongnam-do province's city of Asan 145. Health Minister Kwon Deok-chol said a lack of compliance to preventive measures at such places seemed to be the reason for these outbreaks.
Increased exposure to the virus has been caused by confined, crowded, and enclosed working environments, not wearing face masks, and foreigners living in dormitories. The factories in question have been shut down, while some 1,200 people at nearby companies are also being tested for the virus.
Meanwhile, over in Europe, so I hear variants are threatening containment efforts there, despite an overall decline in COVID-19 infections.
Right, Sunny. In Germany, for instance, the UK variant is now accounting for some 22% of total new infections, according to the country's health minister, which is up from around 6% 2 weeks ago. And in Italy, meanwhile, over fears of the UK variant, now there is a lockdown in place until early April, and also a new rare strain of the virus has been detected there. Now, amid these variant concerns, the number of infections is relatively on the decline. But as we're in the latter half of the week, we are actually seeing an increase again worldwide, with almost 400,000 new infections and also more than 11,000 new fatalities reported in the span of a day. Now, let's take a look at some major outbreaks here. The U.S. at some 28.4 million cases has new infections, around 72,000 new infections, and also the UK, which has been seeing a decline recently, is seeing an uptick again with around 12,000 new cases. Meanwhile, in South Africa, the daily increases are not that bad as of now, with some 2,300 new cases reported, but there are still concerns over the variant there, while the vaccination program has just kicked off on Wednesday local time, also with South Africa's president being one of the first people to receive the shot. And those are the updates I have for now, but I'll be back in a bit after the government briefing. Sunny?
Right, so thank you. I'll see you later. Right, meanwhile, authorities here are poised to carry out another dry run of their upcoming inoculation drive. I have our Kim Dami here in the studio with details on that. Welcome, Dami. It's been a while.
Good afternoon, Sunny.
Right, then let's start with Friday's mock drill.
Right, sure, Sunny. Korea will conduct a simulation of its vaccine rollout on Friday, which is aimed at the safe and quick transportation, storage, and distribution of COVID-19 shots. The drill is a joint effort between the police and military, the transportation ministry, the Korea Disease Control and Prevention Agency, and the Korea Customs Service. The exercise will be made as realistic as possible and will involve a vaccine factory in the city of Andong in North Gyeongsang-buk-do province, as well as local clinics and vaccination centers. The drills will also test the country's capacity to deal with any emergencies that could arise during the transit process.
Right, that's good to know. Now, Thami, our inoculation will begin next Friday with
Right.
AstraZeneca's vaccine, right?
Exactly. The Ministry of Food and Drug Safety has given the green light to the first batch of the AstraZeneca vaccines. The ministry said on Wednesday that the initial doses will be handed out to 787,000 people. Residents and staff under the age of 65 at long-term care facilities and hospitals will be given their shots starting next week on February 26th. Also, the Korea Disease Control and Prevention Agency said it has secured at least 40 million special syringes and that could draw 6 doses from 1 vial of Pfizer's vaccine instead of the usual 5. And for those aged 65 or older, vaccinations will begin in the second quarter of this year. The minister added that the vaccination plan for senior citizens will be finalized in April after experts have conducted a thorough review of all vaccines, including those from Pfizer, AstraZeneca, and also Novavax.
Meanwhile, Thami, a locally developed treatment is now available at local medical centers. Tell us more.
Right, so Celltrion's Recurona, which is the Korea's first homegrown COVID-19 treatment, is now available here in the country. And starting yesterday, the drug has been distributed to hospitals and clinics upon request. And this one hospital in Gyeonggi-do province said it will administer the drug on 7 elderly patients with mild symptoms. Let's take a listen.
We plan to use this drug on patients with mild symptoms first, starting with those over the age of 60, followed by other patients with low oxygen demands.
There are 23 critically ill patients and 60 patients with mild symptoms at this particular hospital, but not everyone is eligible for the treatment. And that's because the treatment is prioritized for high-risk patients, meaning people aged 60 and above, or those with underlying conditions like heart disease, diabetes, high blood pressure, or chronic respiratory conditions. The drug may be cleared for use on a broader range of patient groups, depending on the results of Phase 3 clinical trials, which are still ongoing. And Celltrion plans to conduct global Phase 3 clinical trials in more than 10 countries to gather more data on the drug's safety and efficacy.
The drug will be administered to patients aged 60 and above, as well as those with underlying health conditions or pneumonia-like symptoms. Patients who do not require oxygen therapy will be given the drug within 7 days after the first onset of symptoms.
And there are controversies over the efficacy of this treatment, but Celltrion says the drug will lower the likelihood of COVID-19 patients developing severe illnesses by 54%. To really address these public concerns, Celltrion's honorary chairman Seo Jung-jin held a press conference earlier in the morning. Explaining the clinical trial results of the treatment, Seo expressed full confidence in his personal backing that the treatment is effective. He also added that Celltrion's antibody platform will be useful in the fight against new COVID-19 variants. Regarding doubts over the drug's efficacy on patients with mild symptoms, the honorary chairman said patients with mild symptoms took 2 fewer days to recover after the drug was administered.
All right, Thami, as always, thank you very much for the coverage.
My pleasure.
Right, staying on the local front, it's time now for the regular briefing on the COVID-19 situation here in Korea for this Thursday. As mentioned earlier, social restrictions have been slightly eased from this week until the 28th of the month. The Greater Seoul area now faces level 2 social distancing guidelines, while the rest of the country is under level 1.5. The ban on gatherings remains in place, with 5 or more people not permitted to meet for social purposes. An exception has been granted to immediate family members, only including, that is, grandparents, parents and children. And a few businesses, including movie theaters, internet cafes, video game arcades, cram schools, amusement parks, as well as retail stores, face no limit on operation hours. Meanwhile, restaurants, cafes, indoor gyms, singing rooms, party venues, and indoor standing concert places can be open until 10 p.m. here in the metropolitan region, while those elsewhere nationwide face no time restriction. The briefing is about to start. We'll come back to you afterwards with a summary of it.
First of all, we have Mr. Kwon Junuk with the explanation on the briefing. Let us now begin our regular briefing on the COVID-19 situation here in South Korea for February 18th. As of today midnight, we have 590 new local infections and 31 new imported cases. The total caseload now stands at 85,567. And yesterday, we also had a total of 71,122 tests conducted, and among them in the metropolitan areas, makeshift testing centers, we carried out 28,475 tests. And we also have 536 more people making full recovery and thus being discharged, while 8,127 people still remain in quarantine. There are 161 patients with critical or severe conditions, and we had 6 additional fatalities. I extend my deepest condolences to the deceased and the members of the bereaved families. And let us now go over the updates on our domestic infections by region. In the metropolitan area, we have 432 cases, which is above 70% of the total cases today. And also, especially, we also have family gatherings during the Lunar New Year, and we have 3 gatherings of families being reported as cluster infections. And first of all, in Gwangju's Gwangsanggu city, we have 9 people being confirmed, and also in Ponghwa area, we have 7 people, and Busan's Yeongdo-gu district, we have 6 people being confirmed, each of them through family gatherings. And we are also seeing a very large diversity in the number of cluster infections being taking place. First of all, in the metropolitan area, in Seoul's Yongsan-gu City University Hospital, we have a total of 171 people being confirmed, and also 77 at the Friends Gathering in Yongsan-gu district. And in Incheon's Bupyeong-gu district in Health Clinic, we have 12 patients being confirmed. And in Gyeonggi-do Province, Namyangju City's plastic factory, we identified the first index case on the 14th of this month. We have confirmed 121 additional patients, raising the total to a total of 122. Moreover, in Gyeonggi-do Province, Siheung City, in relation to a manufacturing factory there, we also have 17 accumulated cases being confirmed. And in Chungcheong area, in Asan City, in relation to the boiler factory, we also identified 21 additional patients. And now we have the total standing at 135. And in Jincheon's food processing factory, we have 14 accumulated cases being confirmed to date. And in Gwangju City's hospital, we have 12 additional cases being confirmed, and raising the total to a total of 13. And also moving on to Honam area, in Jeonbuk's Namwon City, we have 3 additional cases, and also 15 family members have been confirmed with the COVID-19. And also in relation to a hot spring in Jincheon City, we also have 17 additional patients being confirmed. And in Gyeongnam area, in relation to Busan's public sauna, we also have 11 total cases being confirmed. And also in relation to Haeundae-gu District's funeral home and insurance company, 32 people have been confirmed, and a total of 26 have been confirmed in relation to a funeral home in Busan City's Pukgu District. And to this end, the quarantine authorities note that recently we are seeing many large-scale business operations, including the manufacturing factories as well as food processing factories being reported as cluster infections. And here are some risk factors that we have analyzed. And first of all, including large business operations and hospitals, we are also seeing after the January of 2021, we also have about 52 cluster infections infecting over 1,300 people, and 22 of them, more than 60%, are clustered in the metropolitan area. And we also see about 10.8 days as the days of infection. And moreover, at the Yongsan-gu District Hospital and the Namyangju City's plastic factory, and also in Chungcheong Province, in Chungcheongnam Province, in Asan City, in relation to the boiler factory. So these are the major examples. And we are seeing the major sources of infection as being the infection spreading through the colleagues. And we have seen that the virus have spread, especially through the confined, crowded, and close contact environment within the shared area. And they also had to speak very loudly because of the noise, and thus they also had a lot of traveling of the respiratory droplets in the air. Moreover, at these business operation sites, we also had very many a large share of foreign workers, meaning that they were living together at certain dormitories. So to this end, the quarantine authorities would like to note that at dormitories as well as crowded workspaces, it is very important to comply with the virus prevention measures. So we would like to highlight this once again. And to this end, as for the managers and the staff members, their participation are very important. They need to supervise the compliance of these measures, and also they need to put a restriction on the hour as well as the number of users for these shared facilities. And moreover, they need to oversee the people's compliance to these antivirus measures, and they also need to promote these antivirus measures to the foreign workers. Moreover, as for those facilities that do not have yet seen a cluster infection, we need to also make sure that we need to enhance our monitoring to this end. Moreover, the Safety Ministry is operating the Safety E-report, and here are some examples of what have been reported so far. And recently, in relation to places of worship, we have seen some lack of compliance to these antivirus measures. For instance, they also set additional tables and desks as well as seats, and increasing the total of capacity there. And also, they also carried out large prayer gatherings at confined areas. And moreover, they carried out daily early morning prayers, and also they engaged in group meals with over 5 people, and they also had some retreats. Moreover, we would like to highlight these compliance to the quarantine measures. When you are at places of worship, you need to wear your face mask. You also need to comply with the attendance gap, and all of these people who are present at the site need to also keep a healthy distance, and they need to refrain from eating together and having group meals. Moreover, they need to ventilate the area on a regular basis as well. Moreover, here are some research and updates on our research and development process. Up until now, the quarantine authorities have said that in relation to the COVID-19, we have also carried out more than 800 cultivations of these virus strains at about 200 health facilities here in South Korea. Moreover, after February, we have also carried out these cultivations of new variants stemming from the UK as well. And we also have been carrying out 10 cultivations of these viruses at 3 health facilities in order to contribute to our vaccine development. And we have also administered the remdesivir drug to over 4,500 people here in South Korea. And as for the regular treatment, which is aimed as the antibody therapies, we also have been administering the drug to a large number of people as well. And as for the blood plasma treatment, we also have administered approved and administered the treatment to a total of 38 people here in South Korea. And as for the social distancing measures, it is also very important to note that our social distancing measures had also contributed to the lowering of the transmission of influenza, which is a similar respiratory disease like COVID-19. And as for the chickenpox, and as for other similar infections, we have seen that, especially for the chickenpox, we have seen a 62% decline in the number of infections. And as for the measles as well, we have seen a large decline of these outbreaks compared to the previous year. Moreover, during these summer holidays, summer times, we also saw no spread of the eye-related illnesses as well. We believe that these quarantine measures, including the social distancing measures and face mask wearing, have contributed to such a trend. We would like to highlight the following. Globally, we are seeing the global COVID-19 daily tally turning to a downtrend. And we believe that this current trend right now we see is also comparable to last year's October, which was before we had a large major outbreak. And to this end, we also like to highlight that we are overcoming this COVID-19 on a general level. And globally, we are seeing also in Americas and Europe, we are seeing many countries, they're seeing a downward trend. And we believe that these factors can be contributed to such a trend. So first being the effects of the social distancing measures, and second is the intensified border shutdown as well. And also, lastly, we have seen a large number of outbreaks in these countries, meaning that many people had also become immune to the disease and the virus, with the more people being developing the antibody. And in South Korea, thanks to the sacrifice and participation and dedication from the public, we have been taking part in the quarantine measures and social distancing measures, and we were able to combat the COVID-19. And relatively compared to Europe and other nations, we are seeing a low number of the confirmed cases. Therefore, we are also having a decrease and lower number of ratio of people developing antibodies. And moreover, this is why we would like to highlight the crucial importance of these social distancing measures here in South Korea, even compared to other countries. So we would like to also highlight these once again. We know that there are many people, many public who are undergoing challenges and discomfort. However, we are also mulling over a revamp in our social distancing scheme going forward. And the quarantine authorities would also like to individually analyze each of these venues which have been subject to cluster infections, and we would also like to develop some social distancing measures which can be sustainable going forward. Moreover, at the same time, if we have a large surge in the number of cases, we will also distribute these therapies that we have developed so far so that we can treat these patients, and we will also spare no support for the medical staff members. And to this end, if we begin the vaccine rollout, of course, we will also need to determine, and everything will be depending on the reproduction rate as well as the conditions. However, if we have developed herd immunity, we believe that even before November, which is our aim right now, we believe that we can control the COVID-19 outbreak to a large extent. And we would like to once again thank the public for your dedication and your participation. And at a time when the quarantine authorities are mulling over a revamp in the social distancing measures, we ask for you to participate going forward. Thank you very much.
Right, that was Kwon Junuk with Thursday's afternoon briefing. So what was the gist of his address today?
Well, let's begin with the recent outbreaks recent cluster infection outbreaks. There have been 3 new cluster infections linked to family gatherings during Seollal or Lunar New Year holidays, and also more infections linked to health facilities. And Kwon also had some updates on the factory cluster infections. In Gyeonggi-do Province's city of Namyangju, the total number of cases linked to a plastic factory stands at 122. And in Chungcheongbuk-do Province's Asan, he said the total number stands at 135. That seems to be the official number from the government. But in recent reports, 149 infections were actually said to have occurred there at the Chungcheongbuk-do Province's factory. And regarding these recent outbreaks at such factories, Kwon emphasized the importance of compliance to measures at shared facilities such as dormitories, in many cases where foreign workers reside at together. And last but not least, on a brighter note, some illnesses that usually become more widespread according to seasons, such as the seasonal flu, measles, or chickenpox, have declined after the COVID-19 outbreak, and that because of social distancing measures such as wearing face masks.
I see, a silver lining there.
Yeah.
All right, so thank you for that coverage.
See you tomorrow.
Right, Korea is looking to play host to vaccine production as manufacturers look to boost capacity amid surging demand worldwide. With details in this report.
On February 10th, Korea granted its first approval of a COVID-19 vaccine, namely that by AstraZeneca, which is currently being manufactured in Korea.
이 백신은 한국 아스트라제네카사가 국내 제약사인 SK바이오사이언스에 위탁하여 제조하는 제품으로 국내에서 처음으로 허가받는 코로나19 백신이며
With the production of AstraZeneca vaccines well underway in Korea, Novavax may soon follow after the signing of a licensing agreement with a local firm. Russia's Sputnik V is also being produced under a license deal in Korea, with the vaccines being shipped to the Middle East. Amid this flurry of deals with global pharmaceutical companies, Korea is fast becoming one of the world's most important production hubs for COVID-19 vaccines.
우리나라는 지금 GMP라는 Good Manufacturing Practice라는 우수 제조 기술 기준을 가지고 전 세계 10등 안에 들어가는 생산 능력을 갖고 있습니다. 표준화가 된 품질 관리가 잘 된 생산적인 기술을 갖고 있습니다. 과거부터 의약품은 많이 이런 생산 기반에서 진행이 됐었고요. COVID-19이 우리 앞에 닥쳤을 때 바로 이러한 기반이 바탕이 돼서 많은 도움이 되고 있는데 외국에선 이런 장점을 활용하고자 저희한테 러브콜을 하게 된 것이고요.
In recent years, many global pharmaceutical companies have outsourced the production of their drugs to CMOs, or contract manufacturing organizations, for the benefit of saving costs. CMOs have been actively engaged in the production of COVID-19 vaccines as well. Novavax has gone one step further by signing a CDMO contract with a Korean firm. CDMO is short for Contract Development and Manufacturing Organization, where the contracted firm is entrusted with a wider spectrum of the drug manufacturing process, including R&D and clinical trials.
It's very important that a contract manufacturing organization like SK Bio can follow the protocol appropriate for making our product. We then have to bring our team of people in, the experienced manufacturing folks at Novavax, in order to take that technology know-how and train the manufacturing folks at SK Bio to be able to make sure that that's being done precisely the right way. And it's that collaborative approach, that know-how transfer is what we refer to as the tech transfer under this licensing arrangement.
A follow-up deal struck between Novavax and a Korean firm in mid-February would allow the production of vaccines for 20 million people ordered by the Seoul government to take place right here in Korea.
I think this is a very important issue. I think, we, Novavax, SK Bio, are intent upon equitable access across the globe, but SK Bio and the Republic of Korea also have a keen interest in making sure that there's sufficient doses in Korea as well.
Korea's production of vaccines has become an important pillar of global manufacturing efforts.
지금 현재의 어떤 대한민국의 수준은 기술력과 더해서 그런 어떤 안전한 어떤 방역 체계 작동 이런 부분들을 종합적으로 고려한 측면에서 그런 어떤 위탁 생산에 대한 수요가 지금 많이 넘치고 있다 이렇게 봐야 될 것 같습니다. 적어도 바이오에 있어서는 코로나19 국면에 따르는 위기가 또 다른 측면에 있어서의 또 기회가 되고 있는 게 아닌가 하는 그런 생각이 듭니다.
Korea's biohealth sector is stepping into the global limelight as an important manufacturer of vaccines for a world that is looking to achieve herd immunity.
변이 바이러스도 위협적입니다. 영국발 변이 바이러스는 전파력에 더해 치명률마저 높다는 연구 결과가 나오기도 했습니다.
모든 해외 입국자에 대해서 PCR 음성 확인서 제출을 의무화하였고 해외 입국자들이 자가격리, 특별관리 등에 대해서 방역 조치를 강화하고 있습니다.
Coronavirus mutations, if left unchecked, may pose a risk to our current containment efforts. For more on this reality, I have Dr. David Kwak from Soonchunang University Hospital. Welcome, Dr. Kwak.
Good afternoon.
And joining our talk virtually is Professor Justin Fendos at Tongseok University over in Busan. It's been a while, Professor Fendos.
Thank you for having me.
Right then, Dr. Kwak, Korea has recorded at least 94 coronavirus variants. Now, how do you assess the spread of these variants here on the domestic front?
I believe it's going to increase, sadly. It's the new variants, what we are experiencing is really just another influx of regular viruses that are coming into the country. What I want to say is that in the past, throughout the experiences with the pandemic, we were already being hit with new variants, even in let's say, June of time when we were hit with the Itaewon cluster in 2021. So the new variants are going to keep coming into the country, and eventually, sooner or later, it is going to take dominance over other variants that are currently existing. So I think we have to take into consideration the factor that it is inevitable, the inevitability that the new variants are to affect our population, whether that be very soon or sometime later. So we have to prepare ourselves to fight against the new variants. One thing in particular that I'm more concerned about is that some of the vaccines that we plan to inoculate ourselves are not so well known to fight against these new variants, more namely those ones from South Africa and the UK. So I think our government has to pay closer attention to making plans for how we're going to fight against these new variants when they do become a more major part of the virus's population.
Right. Professor Fendos, at present, the UK variant accounts for the majority of the variant cases here in Korea. Do remind us about the risks posed by this variant of the coronavirus.
Yeah, so I mean, the situation is quite serious, and I think Dr. Kwak gave a very nice synopsis of what some of the challenges are. So higher death rates, faster rate of spread. So from a practical perspective, what does that mean when this variant reaches Korea and you have a cluster? The cluster is going to be a little bit larger, and the odds of people dying are going to be a little bit higher. So all around, it's bad news. From a scientific perspective, I would like to add that mutations don't always improve the contagiousness of a virus. So there are some cases like Ebola virus where mutations will actually cause the virus to drop out. But for COVID-19, we've been very unlucky, it seems, and I don't think that's likely to happen. I think it's also important to mention, however, that the context is important. So a lot of the numbers that we're receiving, these 20 or 40% increases in contagiousness, these numbers are being reported from countries where systematic mitigation is not happening as well as it is in South Korea. And the better the mitigation that you can do, the less likely that increased risk is actually going to come into effect. So as a citizen in Korea, if I'm following all the right mitigation procedures, washing my hands, wearing masks, and so forth, and people around me are also doing the same, that 20 or 40% additional risk actually becomes quite smaller. So continuing the focus and emphasis on mitigation is absolutely essential.
Right. Now, the UK variant is reportedly looking to become the dominant form of the coronavirus in a number of countries, including the US, in the weeks ahead. For more on this grim reality, I have Kartik Gangavarapul at the Scripps Research Institute live on the line. Hello, Kartik.
Hello, Sunny. Thank you for having me.
Right. Now, Kartik, tell us a bit about the recent study by you and your peers that reportedly show the UK variant is on its way to becoming the dominant strain over in the US.
Yeah, so based on initial testing data, what we find is that the UK variant of COVID-19 is 35 to 40% more transmissible than previously circulating lineages in the US. And the cases caused by this lineage are doubling every 10 days. If the lineage continues to spreading at this rate, it will become the dominant lineage in the US anywhere between mid to late March.
I see. That's a grim outlook. Kartik, given your findings, what are their implications amid the ongoing battle against the pandemic?
I think the important thing to remember, as Dr. Fendos said before, is that you need to have strong mitigation efforts in order to actually reduce the surge because of this new lineage. Previously, the measures that helped prevent the spread of previous lineages will not be as effective because this lineage is indeed more transmissible. And this more transmissibility has been seen in the UK, Denmark, and now based on our study in the US as well.
Professor Fendos, I believe you have a question for Kartik.
I do. Thank you, Sunny. So Dr. Gangaru, the U.S. was a little bit slow in many respects in doing really detailed forensic work on trying to identify variants. And now that they've been doing it for a couple months, we can see that there are at least 8 new variants that seem to be homegrown, as in not imported from other countries. So I was wondering, how concerned should we be about these variants? And also, how concerned should we be about other variants that have not yet been found, either in the United States or other countries where that kind of detailed forensic work might actually be difficult?
Yes, so as you previously alluded to, I think it is important to remember that most of these mutations are just part of the error-prone replication process and are random and have no effect on host disease most of the time. The independently found lineages, I think Dr. Hardcraft and Dr. Camel in their recent study identified that the 677th position in the spike protein had accumulated these mutations independently in many different lineages across the US. However, it's important to remember that the mutations at that position have been found outside of the U.S. as well. Most recently, the B1525 lineage that was identified in Nigeria, UK, Denmark, and a couple of other countries. So the most important takeaway from that study is that we need to continue to employ genomic surveillance to keep a close eye on the mutational landscape of SARS-CoV-2.
Right, Kartik, we'll have to agree with that. All right, Kartik, thank you very much for making the time to join us at this hour with your thoughts.
Thank you very much.
Right, meanwhile, Dr. Kwak, amid the presence of these variants, starting next Wednesday, all arrivals into Korea will be required to hand in a negative PCR certificate. Is this requirement enough, or should we toughen our protocols at our ports?
Well, I really hope that it will be enough, but it's the minimum that we can do. Proving with the negative results from the RT-PCR test has already been being done in many, many other countries. And I actually take part in doing the test for people who are going out of the country currently. So I do see a lot of people not just being tested for one particular PCR test, but for instance, people going to China, they also have to prove themselves being negative of immunoglobulins against these viruses as well. So that is another test that we could take into consideration. But more so, I think people who are once in Korea, after they spend the 2 weeks or so in these social facilities, in the beginning, we used to test all of the people who come in from foreign countries to be tested negative before they were let out of the social facilities. I think we have to bring that back and maybe even strengthen it a little further. At the current level, I believe before it was our social distancing level was at 2.5. We were having people just stay at the social facilities for 10 days, and if they did not show any symptoms, they were let go without any specific test. Now, I believe once we were leveled up, there is starting to test them again. But we need to consider maybe testing them twice before letting them out, or maybe even testing once while they're at the social facilities, but once they're let out, have them come back a week or 2 later and be tested negative once again to make sure that they're not spreading the virus in the society. Some of the measures that I personally can think of right now, but other measures that could mitigate the virus, as many measures that we can take that as long as they don't take toll on the social economy status, I think we should be taking right now.
Right. Professor Fendos, the demand for a negative PCR certificate will not be made to transfer passengers, and some are understandably concerned. What are your thoughts?
I think there are 2 main things to say about this. So first, airports are very unique environments where you can actually contain the motion of people and the way that they congregate and so forth. So these environments are actually pretty good for trying to separate and succeeding to separate out people who might be infected. And we saw good examples of this last year when South Korean airports made a very concerted effort to separate domestic passengers, domestic travelers from foreign travelers. And I am not aware of a single case where a international passenger transmitted the virus to a domestic traveler. And so in terms of the risk factor to the general Korean population, the risk factor is very low for transfer passengers. In addition, another thing that needs to be considered is if the Korean government did commit to testing all of these transfer passengers, the numbers are quite high. I mean, we're literally talking thousands of passengers, sometimes tens of thousands of passengers per day. And that would put a pretty serious stress on the overall testing capacity. So especially when South Korea needs it, like in the months of December or January, when cases are spiking, that pressure would actually come as a pretty strong negative factor. And then you also have the issue of payment. Who would actually cover the cost for all this testing? And I think that would be a difficult thing to sell, at least politically. So looking at all those factors together, I think the Korean government probably made the right choice here. So as long as the systems are designed correctly and nobody makes a mistake, I think it'll be very difficult for transfer passengers to start clusters in the general population.
Right. Dr. Kwak, there are pundits calling for a comprehensive global response to dealing with variants as the challenge is universal. What are your thoughts?
I absolutely agree with that idea. As the new variants come on, as we have seen from many different countries, some of the countries are suffering from the new variant almost up to 90% of the new coming confirmation cases. That means once it starts spreading to other parts of the country, they better be prepared before it actually comes to their countries, and we are in the same place. So in the global consensus, we have to come up with, let's say, a committee that shares all these information and let the whole globe know what is coming up and what we need to be prepared as a whole, the nations. In that way, we will be able to mitigate the virus, not just on a national level, but more so in the global level, and hopefully would also be able to aim for the total eradication of the virus off of this globe.
Right. Professor Fendos, efforts are underway to develop vaccines against variants, but some are worried that the pace of such efforts will not keep up with the pace of the spread. How do you respond?
Yeah, so that is a legitimate concern. And I would say when it comes to the variants, that is the biggest concern, that our ability to pump out vaccines will be outpaced by the speed at which we're creating new variants. And it's very important to mention that this speed of creating new variants is not dependent on time in an absolute sense. So whether we're waiting 1 day or 100 days is irrelevant. What's important is how many people are getting infected in that time period, because every single infection is one more additional opportunity to create a new variant. So over the last couple of weeks, we've seen millions of people getting infected across the globe. That's millions of opportunities to create new variants. And so one of the real key parts of this puzzle is trying to bring those numbers down. And as I alluded to earlier, having better systematic mitigation procedures being used in especially Western countries where they've been struggling with mask wearing and these other protocols, being able to institute those better and convince the public to engage in those better would play a really strong role in decreasing the rate at which the virus is mutating. Probably the seasonal aspect will also come into play as we enter the summer. Probably infection rates will come down again like we saw last year, but mitigation is really a key factor. On the other end, when it comes to increasing the rate of vaccine production, the engineering step is actually fairly easy, especially if we're talking about the Pfizer or the Moderna vaccines, changing the mRNA molecule so that it can now deal with a virus variant. That's not particularly difficult. The issue really is about vaccine volume and how can we actually create enough vaccine that addresses both the older variants and the newer variants that are coming. And so I think both sides of the equation have to be considered as we move forward. And, unfortunately, the data suggests pretty strongly that the current set of vaccines that we have are probably not going to be enough to give herd immunity and to fight off all the variants that we're observing today. And, as we look forward, if we are expecting new variants, more contagious variants to come out, that will definitely necessitate additional sets of vaccines. Whether that's 1 or 2 more or 5 or 6 more, we'll have to wait and see. We're still in the learning process about that.
Right, and staying with the idea of herd immunity, Dr. Kwak, we are seeking to inoculate 70% of the population to ensure herd immunity by November. Is this a safe goal in your view?
Numerically, yes, I do think so. If we are able to inoculate 70% of the whole population, because we would have also at the same time sort of other immunity that goes around the population. I think 70% could be enough, except if we don't prepare ourselves, as I said again, against the new variants that are coming in, that 70% is not actually going to be 70%. It could be deducted down to 50 or 30% because some of the vaccinations will not be able to fight against the new variants. So we have to really make an effort to choose the right type of vaccinations that we are going to inoculate the whole population and the majority of the population so that we could stand at the highest point of readiness against the new variants that are coming in.
Right. All right, Dr. Kwak, as always, thank you very much for your thoughts. And Professor Fenders over in Busan, thank you very much for your insights.
Thank you for having me.
Right, now do keep in mind, one moment of inattention during this pandemic can lead to months of restrictions that can further aggravate our livelihoods. Thank you for watching. See you on Friday.
The flower market has been hit hard by COVID-19, as many events, including graduation ceremonies, have had to adopt non